women decided to take vegetables while the others continued to eat meat and others. And over a period of time, I think it was found they were healthier than the others, I think.
So in current terminology, what kind of trial was this? Who wants to describe this trial for us in just precise scientific terminology? So first of all, how many arms are we talking about here?
2 arms. I think it's an interventional study.
Yes, interventional study, because all experimental, all randomized trials are interventional studies. So it's 2 arm. Is it parallel or is it crossover?
It's a parallel.
Okay. So as opposed to crossover, what would we expect in a crossover design? In this particular case, what would we expect to have implemented in the design? Why do we call it parallel?
You switch the diet in crossover.
Exactly. So we call it parallel because blank. Who wants to fill the blank for us? When you think of 2 parallel lines, what do you expect?
There's no contamination.
Exactly. They don't cross over, right? What you were on, well, just continue on with it. So you think of 2 parallel lines just going straight, never touching each other. So in a parallel arm study, you assign A or assign B, and well, in theory, you're not supposed to switch, right? As opposed to a crossover design where you actually have to switch, So this is a 2-arm parallel arm, was it a randomized or non-randomized trial? What do you think? This study, was it randomized or non-randomized?
Non-randomized.
All right, exactly. So that is a clinical trial doesn't mean that it is randomized. You obviously have non-randomized trials, but of course that carries a lot of biases with them. So in this case, when you don't randomize, why do we randomize? First of all, who wants to explain that to us? What's the point of randomization? What does randomization achieve?
To minimize error.
Is it error, really? Thanks for that attempt, but
to minimize bias.
Thank you very much. So what's the difference between bias and error?
Increase precision.
Okay, let's pack that precision gist. I'll come back to that later, okay?
Manuel, your hand is up. You want to speak?
Let's first of all focus on bias and error. What's the difference between bias and error? But the first person said is to minimize error. The second person said is to minimize bias. What's the difference?
Prof, I think why we randomize is to ensure comparability between the 2 groups.
Okay, thanks. But your answer is still related to the 2 answers that were provided. We're ensuring comparability by making sure that we eliminate bias, right? But that still brings us to the original question: what's the difference between bias and error?
Okay, someone in the chat said bias is systematic.
Okay, as opposed to the answer is incomplete.
Anyone? You can raise your hand.
If you don't get any answers, Ilya, you'll have to answer the question yourself.
I'm waiting for hands. Ben Onoja, you want to say something?
So the person who commented in the chat is halfway correct. It says that bias is systematic. So what's the opposite? If something is systematic, what's the opposite of it? If you are systematic or you're what?
Well, there's no okay. Is it that systematic or at random error?
John Shockers, you're very clever. He says it's non-systematic. That is so funny. All right, yeah. So the opposite of systematic is error, right? Random. So bias is something that occurs systematically. And let's unpack that word. We use that word a lot. Like, just so we're all on the same page. When we say something is systematic, what does that even mean in the first place? When we say something is occurring systematically, what does it mean? So we don't just assume, let's not assume that we all know what that means, because there's likelihood that some of us might not understand what we mean when we say something is systematic. So who can explain that to us as you would to a child? What does it mean when we say something is systematic?
I think for me, it will mean that step by step. So it goes step by step, or in maybe more advanced versions, it's a logical uh, uh, um, flow of events. I think that's what it is for me.
Okay, thank you very much. We have other hands up.
Ben or Noja?
Yeah, something that has a pattern.
Very good. That's a pattern. Very good. Any other thoughts?
Francis?
Yeah, something that has a pre-designed order.
Exactly. So when you come to your house, exactly.
Defined order.
That's correct. That's correct, right? If you come to a house, you see the blocks laid step by step. Somebody said step by step. That's correct, right? See, there's a structure. There's the blocks aren't just run. The builders didn't just toss the blocks up and the blocks wherever they landed. No, they put one block after the other. So there's a system to read, right? So you can always predict that the next block will also appear here because of that pattern. So you're all saying the same thing, and that's all correct. So that's what systematic means, right? So if you take a bag to the airport and you want to weigh the bag, if you have a faulty machine, it can still give you wrong answers, but in a way that are systematic. So every time you imagine, let's take the classic way. If you have a dead clock in your house, every time you look at the clock, it says 12 o'clock. Well, it's systematic, right? That's in a very shallow example to demonstrate that. So bias occurs in ways that are predictable, that are structured, right? Think of it as error with an agenda. It's error on steroids. So that's the difference between bias and and error. Error is just think of it as an honest mistake. When somebody commits an honest mistake, it's like, oh wow, well, it was an accident, it was an honest error. Bias is not by mistake. There is a pattern to it. It's an intentional mistake, right? So that's how you can think of it. One is an honest mistake that happens. The other one is an intentional mistake. So if it's intentional, that means that it will happen again and again in a similar scenario. So there's a predictable pattern to it, right? And we worry about error because error has an impact on what? Why do we worry about error? Error has an impact on blank, and bias has an impact on blank. Who wants to fill in the gaps for us? So let's take the error first. Error has an impact on blank. What's the blank? Somebody mentioned something earlier, and I told them to pack it, and we're going to come back to it later. Who was that person? Dan, this is when you step on and answer that question. Error has an impact on what? Where is the person? Have you disappeared on us?
Precision.
Exactly. Error has an impact on precision. So when we narrow error, when we narrow the level of error, we increase what? Precision, right? So we try our best in research to minimize error, because by minimizing error, we are improving precision. Now, on the other hand, bias has an impact on what? And it's not accuracy, exactly. So bias has an impact on accuracy, which we also call what? What's another name for accuracy?
Validity.
Excellent. So you can see that those two things are extremely different. Yeah, you're absolutely right. So the reasons why we worry about error are quite different from the reasons why we worry about bias, because they are affecting different things, right? We worry about error because, well, if you reduce, for example, sampling error, we will improve the precision of our estimates, right? That has nothing to do with validity. Now we worry about bias because, well, it has an impact on validity. And so, of course, we want our results to be both accurate and precise. That's why we have to worry both about bias as well as error. that we need to understand with them. So, well, this is a very big digression. This is a very big digression from a topic of a day, but well, that's fine. We'll just take it in stride. So yes, so we said the first trial was that recorded. And so we said there were two interventions. One was the diet of meat, the other was the diet of vegetables. The duration of the study, this is how long was this study period? For those of you who read this sacred text. How long was this study? 10 days. Now, in the real world, do you really believe that 10 days is enough to experience real world, effects from such a dietary intervention? No, well, I wish you give me a diet that would make me lose weight in 10 days. Oh, if anybody manufactures that diet, you become a millionaire, right? Everybody will come and buy that diet from you. So this was maybe a clinical trial with some supernatural intervention, but well, it serves as a point to help us understand what trials are all about. And so that helps us understand that in general, in studies, we have what we consider as an experimental treatment or a new treatment or intervention, and we also have a control group, right? Now, if we think of the study design, when we're thinking of study design, we must worry about things like sample size, right? Because if our study hypothesis is like this, a spaceship, then the fuel is the sample size, right? If you don't have enough sample size, if you don't have enough fuel in your rocket ship, what happens? It crashes down to Earth, right? And then you might conclude that, oh man, I was not destined to get to the stars. I was never meant to reach the stars. Well, you were. The only problem was that you didn't have enough fuel in your jet engine, in your rocket, right? So that's how this disastrous poor sample size or limited sample size calculations can be for studies. So we really need to make sure that our studies have sufficient sample size. Otherwise, it's going to crash. Our hypothesis will crash and burn, and we'll conclude that, oh, we're not meant to reach the stars, but indeed we were. And that brings us to statistical errors. Oops, sorry, my battery's almost died. All right. We'll talk about, yes, Ben, you have your hand up.
Yes, sorry, since you've mentioned the sample size now, I want to just quickly chip in a question.
Sure.
If one is to sample, let's say a particular disease in cattle in 6 different states, how will one be able to know the sample size of the states that he's going to get the cattle from?
Okay, let's bench that for the end of the class and we'll answer that question, okay?
All right, thank you.
You're welcome. All right, so we need to understand, we need to have, whether it's calculating sample size among cattle or for our arms of our study, we need to make sure that we have enough people. Otherwise, we run the risk of type 2 error. Who remembers what type 2 error is? Longile made a post about this a few days ago, I believe. Who remembers what type 2 error is? Nobody?
Evidence of absence.
Evidence of absence. Can you elaborate, please?
When what you're looking for does not exist, but that doesn't mean that it doesn't exist actually.
Okay, can you put it in a simpler way so that explain it the way that my grandmother will understand, please. My grandmother did not go to any school, so you have to really, really make it very simple.
Okay, when there's no, you didn't see any results, there's nothing to show. That doesn't mean that it does not really exist.
Okay, that's good. Or we call that what? Who can describe that in 2 words for us? Who can, all of that, okay, to rephrase it in 2 words, what would those be?
Someone dropped in the chat, false negative.
Excellent. So false negative. What's the illustration For those of you who read Lungile's post, what's the illustration we used to remember this with? Remember the story of the boy who cried wolf?
Yes, making an alarm where there is no alarm.
All right, who can tell us that story? What happened in that story? We know we like stories here because we have to make sure our grandmothers understand. So who wants to tell us that story and draw out the meaning of type 1 and type 2 error for those who may not understand?
You can raise your hand.
What happened in that story exactly?
No one.
The boy was
Okay.
always crying. The boy was always crying that there's a lion. There's a wolf. When there's no wolf actually. So the day that a wolf actually came attacking, and then he was crying, nobody was there to help him or rescue him.
Exactly. So what was the first error that happened in that scenario? Because there were two errors that happened. What was the first error?
I think that was type 1 error.
Yeah, but from a story now. Let's not get technical yet. Just from a story, what was the first error, first problem in that story?
That's false positive.
The first error was that I don't know. Should I say he was telling lies?
The crying wolf when
there was no wolf.
Exactly. So crying wolf when there was no wolf. So in a real world study, how would that appear? What would that appear like?
That's a false positive.
Yeah, but how would that appear like in a research study? So if we were to drop down these labels and put it in an actual description of what that will appear like in a real world study, what would that look like?
The conclusion would be that a variable is present, or a factor that is being looked for is present, whereas it is not.
Okay. And thank you very much. Any other attempt?
Saying a man is pregnant when he's not, when he cannot.
Okay. Or it could just be like, wow, our study found, we found a very significant relationship between A and B, right?
Let's say that there's an association when there really not.
Exactly, yeah. Right. You declare that your study found an association for whatever you're looking for. It may not be something as bizarre as saying a man is pregnant, but it could just be that, your study is looking at the relationship between, let's say, exposure A and outcome Y. You did the analysis the first time, you didn't see anything, and then you proceeded to do what? So you did the analysis the first time, there was no signal association, and then, you proceeded to do what? Who wants to complete that sentence for us? That story for us?
Hacking.
Okay, very good. Meaning what?
Forcing the information to produce a desired result.
Okay, and what would that look like in real world scenarios? Like, what would they proceed to do in practical terms that might end up giving them the
Increase
result?
sample size.
Well, they may not necessarily have the ability to increase the sample size, right? If they're working with a fixed data set, that's what they have. So they may not necessarily increase the sample size, but what might they proceed to do?
They might just multiply the sample size by
Adjust the findings.
amplify the finding.
They may not be able to adjust the sample size because it's fixed. Remember, you can't increase your sample. Your data set has 200 people. You cannot increase it. But what might they do? What have you guys done? All of you have been hacking P-values. Tell us this is the time where you can confess your sins. Like, what have you been doing?
Let me read the response. The person says, fail to reject the null when the null is actually true.
Yeah, that's technical explanation. We want practical, like, what does that look like in practice? Okay.
No hand.
Any hands?
No, sir.
All right. Well, the most common expression of that is just to start doing a whole bunch of subgroup analysis. So we took our sample size of 1,000 people. We did analysis as we had proposed to do originally in our protocol. We didn't find any results. We now start testing that same association among males and among females, among whites, among blacks. We're just hoping that one of them will show a significant relationship. Now, keep in mind that in our protocol, we did not say we're going to do all the subgroup analysis. At the end of the day, we've done like 300 subgroup analysis among different, subpopulations. And then finally, we found one subgroup that is significant. We now say, wow, this is how we now write the results. Oh, while results in the overall population were not significant, subgroup analysis among this group showed a strong association. You never told us that this was after doing 3,000 subgroup analysis until you found the one you're looking for, right? This becomes a fishing expedition, right? So that's type 1 error. You are very flamboyantly declaring in, the New England Journal of Medicine or whichever journal you published in that, wow, our study found a significant association. In other words, we found a wolf here, but you actually did not find any wolf. You just went on a fishing expedition, all right? That's type 1 error. Type 2 error, however, is when we actually now found a wolf, the cry is, the cry is not announced, the villagers do not come because they did not hear the cry. And this happens when we have small sample sizes, right? Your results end up not being, your sample ends up not being, powerful enough to detect the difference that exists between the groups, right? So that's type 1 and type 2 error. There are questions here. Let's see. Do you want to raise up your hand and ask your question before we move on here?
Is it me?
Yeah.
Whoever owns the questions?
Peter.
Yeah, I was asking if that kind of expenditure not produce serendipity.
What exactly do you mean by that?
Oh,
Well,
I mean accidental findings.
Yeah, that's the whole point, right? The point of type 1 error is that you find results that they are just artifacts. They don't exist in nature. You just found them. Like, if you look for anything, you're going to find it, right? Even ChatGPT can create hallucinations of things that don't exist. That's type 1 error, right? It's the same thing you finding things that don't exist. There's a second question that says, where you find a smaller wolf? Can you please explain what you mean?
Okay, thank you so much. So I was just, as you did talk, I was just reflecting about the fact that, okay, yes, you did go to find a wolf, and then you didn't see that, and then it's indicative that, well, there's a possibility that there's a smaller one hanging around, maybe because I'm just hypothesizing, maybe because of how the weather looks like, or because of the feelings that you are getting or something. And now if we bring that into research, so yes, maybe you wanted to find out, for instance, if engagement was positively influencing students' outcomes. And then you found that no, it is not. But when you turn on to look at gender, you found something there. So really, that shouldn't be reported.
It should be reported if you had this is why we write protocols. When we say you should write a protocol, a proposal before you do your research, it is not just an empty exercise. It's for you to declare that this is the goalpost and this is what we're going to stick with, right? Research is based on an intentional search for knowledge. It's not that we now define a goalpost and we now start moving the goalposts. Because if you now declare in your protocol that this is what we're going to do, and you now completely, so like, what's the point of writing the protocol then? When you now completely abandon the protocol, and you're like, okay, who cares about that protocol anyway? We're just going to go on a fishing expedition here until we find something. That is no longer research. That's now something else that I don't even know what to call it, right? So research has to follow the rules that were set for it as defined by a protocol. So for those of us who are supervisors, who supervise students, protocols are not written just for the fun of it. Protocols are meant to dictate how the work will be done. So we can't we can't keep moving the goalpost because that is actually unethical research, right? Things have to occur per protocol. And there's no issue, there's no such thing as a smaller wolf, because that question presupposes that wolves lie on the spectrum, where we have the big bad wolf, then we have like a smaller, more gentle wolf, and then we have a baby wolf. Like it's either a wolf or no wolf, right? So when we have declared that we're going to set statistical significance at, let's say, this alpha level, it's either the result was present or was not present. It's like pregnancy. It's either you're pregnant or you're not pregnant. So it's either we found a wolf or no wolf. All right. So the same thing with type 2 error. It's either we found an association or we did not find an association. Okay? You know, it's not complicated at all. So type 1 error, is, you know, fishing expedition. Type 2 error is when we fail to detect a difference, even though it exists in nature. All right, let's move on. So there are many types of trials, but for the sake of this lecture, we'll focus on 2 of them: non-inferiority trials and superiority trials. These things are actually obvious from the names, right? From the way it sounds. From the way it sounds, what does non-inferiority trials, what does it sound like to you? What do you think that trial is supposed to do? Just from the name of the name. This is the beauty about epidemiology. The names of most things we use in epidemiology are actually just self-intuitive. So that once you read the name, it's clear to you that what is being assessed. So what do you think we're assessing in non-inferiority trials, and what are we assessing in superiority trials? Yes, Taiwo, your hand is up.
Yes, Taiwo. Yes, thank you very much, sir. For non-inferiority trials, we want to prove or show that the intervention is similar in efficacy to the control. And maybe there's an existing medication, for example, and we know the efficacy of that medication. And maybe, for example, let's say a patient with diabetes, we know that a particular existing medication can reduce the A1C by maybe 2%. And we have a new medication that we want to test against that existing medication. We want to prove that the new medication is equal in efficacy, that is not inferior to the existing medication. That is for non-inferiority trials. For the superiority trials, we want to prove that the new medication performs better than the existing medication.
Okay,
existing
thanks.
Device.
All right, thanks so much. I'll score you 99.95%. The only reason why I'm taking that 5% from your scoring is because you said that the goal is to prove that 2 interventions are equal, right? Statistically, it's extremely challenging to prove that 2 things are equal, right? And that's why we don't call it equality trial, we call it, you know, non-inferiority. So we can just prove that this is non-inferior. The goal is not to prove that they're equal per se. This is where the terminology matters a little bit, because we don't want to say that we're trying to prove equality. What we're trying to prove, as the name implies, is that it's non-inferior. It's not inferior to the gold standard. Now, what are superiority trials? From the name, what does it mean? What are we trying to achieve?
Superiority means that the new medication or device is better than the gold standard or the existing one.
Excellent. So that's exactly the case. And so when we look at superior trials, we're trying to say that this new treatment is better than the control. And for non-inferiority trial, we're saying that it is not worse than a control, right? So if you look at the graph here, this is what we expect for superiority trials for this to be, right? And for non-inferior trials, this is what we expect it to be. Take note that in a non-inferiority trial, we're not trying to prove that it is superior. No. The agenda of a non-inferiority trial is not to prove that the new treatment is better than the standard of care. It's just designed to prove that it's not inferior. So this is the only part we're looking at. So just looking at these 2 graphs, here's a quiz question. And non-inferiority trials, are they, you know, 2-tailed hypothesis, or is it a 1-tailed hypothesis? What do you think? One tail or two tails?
One tail.
Just so we're all of us in the audience are very clear about what we're talking.
One
Can somebody
tail.
elaborate on that and tell us, like, what do we mean when we say a hypothesis is two-tailed? And why is this one-tailed? So that we're all on the same page.
Can raise your hand.
When effects are both ways, there are two tails.
Okay, thank you. Both ways. What do you mean both ways? What does both ways means? Why I still have you on the line?
If A causes B, B causes A, hypothetically.
Okay, so that would not be what we're that would not be. So causality is always in one direction, right? So think of a hint of here the hint here. The word, in marriage, right? When you're doing wedding vows, they say for riches or for poorer, for better or for worse, right? So when we say when you use that as a hint, what does a two-armed or two-tailed test? What is it looking to find? You can take a hint from the wedding vows. And Peter, you're the one who answered. Do you want to reframe your answer?
New treatments is better in the control than old treatment.
Okay, Taiwo.
Thank you very much.
Yes, sir. For the one tail test, it shows that even though this new medication may not be inferior to the existing one, or may even perform better than the existing one, we are not interested in whether it performs better. We are only looking at the fact that it's non-inferior. That's why it is one tail.
Thank you very much. The month of January, the first month of the calendar, who can tell us what the month of January is named after? For those of us who love reading classic literature. Emmanuel.
Manuel, are you here? Okay. Taiwo, is that an old hand or you want to answer the question? Okay, Hezekiah said Janus.
Yes. So the month of January is named after Janus. Let me show you the picture of Janus for those of us who do not know who this god is. So this is the picture of Janus. He is always depicted as the god with two heads, right? One head faces the front. This is why the month of January is special, because it is the beginning of the year and it's dedicated to Janus, because the one head of Janus faces forward, facing the future. The other head faces backward, looking at the past, right? That's why the month of January is named after Janus, the god of gates, doors, and beginnings. So if you were to be, let's transport you back to ancient Rome. Will you rather be protected by a god with two heads or with one head? What do you think? What will make you more secure? A god with just one head that faces forward, or the god with two heads that faces forward and back? What would generally make you feel more secure? Just curious.
Forward and back.
Exactly. Why would that be the case? You don't want any surprises, do you?
Can see from multiple perspectives.
Exactly. So that is why, in general, we prefer a god who looks in both directions, right? Both forward and backwards. Than the guy who just looks forward and like, oh my gosh, you get a surprise. We don't want surprises. I think we've collectively agreed. So that the same thing applies with tests. Do you want a two-sided test? A two-sided test considers the potential that, oh, well, this treatment that we're looking at, it's possible that it could be better. That's what we hope. But it's also possible, just in case, we also want to consider the possibility that it could be worse than what we have. Imagine that you were introducing ChatGPT into academic curriculums. And your hypothesis is that, well, we think that ChatGPT would improve academic performance. That's what we want to test. Is that a very reasonable choice? What do you think? Just saying that, oh, we're going ahead to test the hypothesis that ChatGPT inclusion in curriculum will improve academic performance. First of all, what kind of hypothesis is this? Is it one-tailed or two-tailed?
One-tailed.
It's one-tailed because it's facing only what?
It's one-tailed.
It's one-tailed because it is?
It's looking in just one direction. One direction. One consideration.
Exactly. You've only considered that it will improve academic performance. But what's another possibility that you have failed to acknowledge? That it could do what?
To actually make students lazy and not learn.
Exactly. So it could actually decrease academic performance or, impair academic performance. It is possible. Now, if we knew the answer already, would we do research?
Not necessary, sir.
Not necessarily. So if we already knew the answer, then there's no point of doing the research. So since we don't know the answer, what should we logically do then?
Use two data.
Exactly. And that's why we always encourage people. Some people come confidently and say, oh, well, I just want to do one tail test. Like, okay, it seems you already know the answer. And if you already know the answer, then you should not even bother doing the research, right? But if you don't know the answer, then why don't you explore a two-tail test, right? For people who insist on doing a two-tail test, a one-tail test, why do you think they sometimes insist on that? What do you think is the reason, the rationale for insisting on a one-tail test in terms of practical considerations? What are they trying to avoid?
Okay, Ben.
I think for those doing one-tail test, they are trying to avoid stress.
Stress in terms of what?
Of repeating the experiment the other way around.
Well, you don't even have to repeat the experiment. You just do the experiment once, but we're just saying that statistically, your study is powered to detect differences. So it's not as if you are manually going to do it one way and then do it the other way around. But statistically, your study is powered to detect both differences in either direction, right? So that leads us back to the question. What are they trying to avoid practically? Like in terms of practice now.
Lawrence.
Thank you very much. They are trying to avoid large sample size.
Excellent. If a study is two-tailed, it's going to have what?
Two-tailed.
If a study is two-tailed, it's compared to this
one-tailed. If the study is two-tailed, the significant level will be divided by 2.
Let's just focus on sample size for now. Will the sample size in general be larger in a two-tailed versus a one-tailed test? In general?
Yes, sir. Larger in two-tailed than one-tailed.
Exactly. Think of it, right? Think of it in terms of resources. Like we experience these things in our daily lives. They should be very intuitive to us. If you want to cross a two-sided road, do you spend more resources in terms of, let's say, just time now, compared to when you're crossing just a one-way road, which would take more cost, like resources, not just focus on resources like the time you have to spend. One-way road or two-way road. That should be very intuitive, right? In a two-way road, you have to look left, right. This is what the teachers taught us when we were young, right? Look left, right, and left again. Well, in a one-sided road, in a one-way road, you only have to look one direction only. You don't have to, well, in these days, you don't know crazy drivers anyway. But we're saying, considering all things being equal, you only have to look one direction only. But in non-inferiority trials, we have set out to only examine one direction, right? So that is why this is one-sided, because we're not interested in knowing that, oh, no. Our hypothesis is framed only in one direction. And that's why this is, one-sided versus two-sided for superiority trials. Now, as we say, extraordinary claims require extraordinary evidence. So that's why we have to, for a two-sided test, right? The claim of superiority is a major claim. even when you just look at the face value of the words, something is superior, something is non-inferior. That superior, that is just an enormous claim. And so, that's why we have to look, front and the back, look at both directions to make sure that we're not missing it. So let us look at the case study, for example. Let's say we have a new drug. We have an investigational new drug, Ozempic, and we want to compare it with Ozempic, which is the standard of care. Our question is about, weight loss. In a superiority trial, our null hypothesis will say that there's no difference between the two drugs in terms of weight loss. Our alternative hypothesis will say that a new drug is better than the standard of care, right? So take note that in a superiority trial, the null hypothesis is that there's no difference between the two drugs. That's very important to note, right? And our outcome, we can define our outcome however we want. Let's say we can define our outcome as the proportion of patients who achieve a weight loss of at least 5% of their body weight over the 6 months study period. That could be our outcome of interest. Now, for a non-inferiority trial, take note that the null hypothesis changes dramatically. The null hypothesis for a non-inferiority trial is that the new drug is inferior to the standard of care, right? Why do you think that we cannot use this null hypothesis for a non-inferiority trial? From common sense, why do you think that this would be a dangerous null hypothesis to use when we're doing a non-inferiority trial? Imagine that if a pharmaceutical company has developed a new drug and there's already a standard of care, because the reason why we use non-inferiority trials for ethical reasons, we already have something that works, all right? They just want to demonstrate non-inferiority trial. What's the danger of saying that the null hypothesis, there's no difference? Just from common sense. I'm not asking for complicated scientific reasonings. Just
It means
common
the
sense.
other drug, it means the other drug will have to be taken out totally.
Okay.
I think there's no need for the new drug.
Okay.
It could affect market value.
Advantage. There's no comparative advantage of that one.
Okay. What stops the company from just grabbing 5 people? Remember that type 2 error, right? What happens in type 2 error?
You accept the non-hypothesis when it's supposed to be rejected.
Okay, so in other words, we conclude that there's no difference, right? When there's actually difference. And we say that the main difference for a type 2 error is because of what?
Not enough sample size.
Exactly. Now, when we're doing a superiority trial, right, that conclusion that there's no difference is not what we want. But when we're doing a non-inferiority trial, that's exactly what we want to conclude, that there's no difference, right? What stops the pharmaceutical company from saying, oh, we're just going to grab 3 people and say, oh, we're going to compare them, and then, of course, we're not going to find a difference, and then we'll go to the null and say, oh, see, there's no difference. Do you understand what I'm trying to say?
No.
All right.
They will not constitute enough sample size.
So we're saying that, right? If the null hypothesis of a non-inferiority trial were that there's no difference between the two drugs, do you understand how dangerous that would be in the design of studies? Like, who understands what I explained that and I want to reframe it in a different way? When you consider it,
I can say that the new drug is going to perform the same way with the old drug.
So yeah, so if that's the null hypothesis, any sample size that is small, you just pick 3 people, 4 people. Your study won't be powerful enough to detect differences, and you conclude, oh, well, there's no difference, right? Because this is what you actually want to find. But when we say that your null hypothesis is that your new drug is inferior, right? What does that motivate you to now do in terms of type 2 error?
Increase the sample size and carry out the analysis again.
You want to make sure that your study does not fall prey to type 2 error. Because if your study falls prey to type 2 error, we will end up coming back to the null hypothesis. And then the null hypothesis here, does it favor you?
It's not favorable.
No, it's not.
The null hypothesis here does not favor you at all. The null hypothesis here favors you a lot. Because all you wanted to demonstrate was that your study is not different. It's non-inferior. This is why we can never use this null hypothesis in the non-inferiority trial. Because the null hypothesis is already here, is already starting to favor you. Because this is exactly what you want to find. So you just conduct any shabby study and conclude that, yes, there's no difference. We don't want that. So the null hypothesis for a non-inferiority trial is designed in such a way that you are going to be you're going to be severely punished if you design a very poor study, right? If you have a very small sample size, well, you're going to end up concluding that your new drug that you have spent millions to develop is inferior to standard of care, right? So there's incentive baked into that design to make sure that you conduct the study properly. Do we all understand that?
Yes.
Yes,
Any
sir.
questions?
Yes, sir.
So the moral of the story is that please take note that it's not all studies that you just say that the null hypothesis means there's no difference. No. You know, for a non-inferiority trial, this is different. So how do we set the zone of non-inferiority? So this is the zone we're saying here. So we're saying here that when we're conducting a non-inferiority trial, we first of all define this zone here. We can say that between this zone, between this level here and here, we can conclude that if the new drug performs within this area, we can then conclude that it is non-inferior to the standard of care. This zone has to be defined upfront. So the question is, how do we determine this zone? Any thoughts? How do you determine the zone of non-inferiority? Well, we
use the p-value.
No, that would not work. But we can use the confidence interval. So we can use for example, we can look at the original treatment, right? If the original treatment showed that, this was the main effect and the confidence interval range from the low to the high, we can use a lower margin of the, original confidence interval, right? Or we can have a panel of doctors come together and say, what do you think? What performance will this new drug put that you will consider to be non-inferior to the standard of care? Sometimes that margin is also determined by regulatory agencies like the FDA, right? So for example, if the original drug was associated with these effects and the confidence interval range from 23% to 57%, we can then take this lower margin and say that if the drug performs between 23% to 40%, or the margin is 17%, we'll consider that as the zone of non-inferiority, right? Or it could even be a fraction of this, like 75% of this, right? However it's calculated, the goal of non-inferiority trial is just to demonstrate that this new treatment is not inferior to the standard of care. So now, how do we calculate the sample size for these different studies? You already have access to the Chisquares platform, and this is something you should know by now, but I'm going to go ahead and demonstrate how we can do that. But before we calculate the sample size, there are some things we need to be aware of. We need to be aware that when you have multiple arms in a study, the complexity of a sample size calculation increases significantly. Well, if we have, multiple arms, it's like, when we have just two groups and we're comparing the group one to the other group, it's just like it's simple two-way traffic. There's no complexity there. But when we have multiple arms and we're comparing group 2 to group 1 and group 2 to group 3 and so on and so forth, it's like a busy intersection, right? The risk of having an accident here is much more higher than this one here. So that's the same thing that happens with the multi-arm interventional study. There are so many comparisons going on. Because think that for you to cross this intersection, you have to compare this and this and this and this, and you have to look at so many corners. So the same thing arises with multi-arm studies. Most times we end up doing a lot of pairwise comparisons. If we're looking at 3 interventions, we might end up comparing, not just A and B, but B and C and A, right? And the more comparisons we're making, that brings us back to the issue of type 1 error. So we have to account for all of those things in our sample size calculation. So when we're doing sample size calculations for multi-arm studies, we need to directly account for those things. So when we have 2 arms, it's simple, right? Group A and B, we look at, there's no issue of multiple comparisons here, because comparing A and B is the same as comparing B and A. So 2 groups, there's just one comparison, A versus B which is the same thing as B versus A. When we have three groups, it becomes a bit more complicated. We have to compare A versus B, A versus C, and B versus C. So when we have three groups, that's three possible pairwise comparisons. When we have four groups, that becomes more complicated. We now have 6 comparisons, right? And in general, for n number of groups that we have in our study, the number of possible comparisons is n choose 2 or n combination 2, which is calculated by n factorial all over 2 factorial and n minus 2 factorial, right? That is the number of possible pairwise comparisons that we're going to have in that study. And so that increases the risk of error. So all of those things have to be factored in our sample size calculation. So sometimes some of the questions we get, people might say, oh, I calculated sample size by hand, and what I got is different from what is on the platform. Well, that is because there are 2 different sample size calculations possible in this kind of context. You have the nominal sample size and you have the effective sample size. What you have calculated is you just took a formula and you're just plugging in the values to that formula. That gives you what we call the nominal sample size. But that is not good enough in the real world. You have to consider real world complexities, right? You have to consider all these other things that have to be adjusted for. So when we adjust for all the things that need to be adjusted for, and we get the final sample size, that's what we call the effective sample size. So we need to understand that there's a difference between the nominal sample size, which is just what you get by plugging in numbers in a formula, versus an effective sample size that accounts for all the complexities in the real world. So in this case, we obviously have to account for pairwise comparisons. Now, when we're doing multiple comparisons, when we're doing designing studies with multiple arms, we need to have a logical reason why we are doing so. Otherwise, but that's the whole point of doing research, right? There's a theoretical basis for what we're trying to achieve. So let's say I'm trying to compare, individuals into 3 arms. My research question is the likelihood of making a sustained smoking cessation lasting 6 months or longer different among current daily cigarette smokers using e-cigarettes as a quitting aid compared to those using FDA-approved nicotine patches? So here I have 3 interventions. I have nicotine replacement therapy, which is being administered as a patch. I have e-cigarettes as 0 nicotine and e-cigarettes as 10 milligrams, right? And my rationale is quite different for each of those, right? I have a comparison here as nicotine, the nicotine patch, but I have 2 interventions, 0 milligrams and 10 milligrams. There needs to be a theoretical basis for why I'm trying to compare those things. So for example, the first comparison here, which is 0 milligrams versus, 0 milligrams nicotine e-cigarettes versus nicotine patch. Here, I'm just looking at the effect of nicotine, because this one has nicotine, this one doesn't have nicotine. How effective is nicotine when delivered as a patch compared to no nicotine, right? That's the theory I might want to explore. Here I have 10 milligrams nicotine and nicotine patch. They both contain nicotine. So the research question here is, does the route of administration matter? Because here I'm administering nicotine as a patch. Here I'm administering, as vaped, right? So the question, what I'm assessing, since nicotine is present in both, the question here indeed is does the route of administration matter? And here I'm comparing 10 milligrams, nicotine e-cigarettes versus 0 milligrams nicotine. So here the research question is, does e-cigarettes as a device itself influence, independent of the, effect of nicotine, right? So the point I'm trying to make here is that don't just put a whole bunch of pairwise groups and just say, oh, just because you can, doesn't mean you should do so. There should be a theoretical basis for why you're doing all of those comparisons. All right, so let's head over to the Chisquares platform and see how we account for sample size calculations for superiority trials versus non-inferiority trials, and also when we have multi-arm studies. But before we do that, are there any questions from what we've discussed so far? I want to take questions before we move on to see how we can calculate sample size and also generate proposals or protocols for studies that we might want to do that involve clinical trials. So any questions so far from what we've covered?
If you have questions, you can raise your hand or drop them in the chat. Okay, Emmanuel.
Yeah, Prof, thank you. If you could recap the last thing you said, that's number one. Then number two question is for groups that might have different arms or different numbers in the arms, what might be the impact of those disparity numbers in the study? Thank you.
Okay, so I think it's best explained by seeing it as opposed to talking about it. So let's go ahead and do a sample size calculation, and we're going to see what effects adjusting for multiple comparisons has. In general, of course, it's going to increase the sample size, but let's see that in practice. So let's first of all head over to the sample size calculation and look at what that entails. So let's start a new sample size calculation. And so we'll first of all demonstrate for a superiority trial and then for non-inferiority trial. So for a superiority trial, we have to come to, so let's start with a two-arm parallel design. So this is a comparative study with two arms. Let's say with percentage as outcome for the study we're trying to explore. The study type will be a randomized trial. We'll now have to select the prevalence of outcome among the non-treated or control group. So imagine that we're just simply looking at nicotine replacement therapy versus 10 milligrams of e-cigarettes, right? Here, our control group is the nicotine replacement therapy group. So the question is, what's the prevalence of smoking cessation, of sustained smoking cessation among individuals on nicotine replacement therapy? This is something we can easily find from literature review, and prevalence around 10%. Now we have to figure out, whenever we're doing sample size calculation for a comparative study or analytical studies, we must specify the effect size. The effect size simply says, what is the difference we want to detect? What is the minimum difference we wish to detect between the groups we are trying to compare, right? Now, here's a quiz question for you. If we want to detect a small difference, a tiny difference, would that require a bigger sample size or would that require a smaller sample size? What do you think?
Bigger sample size.
Exactly, right. You can think of it, we always give the example of a microscope.